Welcome to Primary Sense in Practice, a series of short practical videos developed for healthcare professionals. In this series, we'll show you how to use and understand Primary Sense reports so you can make informed, data-driven decisions in your everyday practice. Let's get started. Primary Sense is provided at no cost to general practices by your PHN, making it the most widely used and preferred clinical decision support tool across Australia. All data used by Primary Sense is fully de-identified, protected by strict privacy measures, and stored securely within Australia, and it is never sold or commercialised. To run a report, click on the Primary Sense icon on your desktop or taskbar. From the expanded menu, click on the Reports icon and double-click on the desired report you'd like to run. The Health Assessment Report provides lists of patients who may be eligible for proactive care through a health assessment. Aimed at preventing or delaying the onset of chronic disease, the report enables practices to easily identify and recall patients aged 40 to 49 who may be eligible for a health assessment, Aboriginal and Torres Strait Islander patients, patients aged 75 and over, and women aged 35 to 55 with menopausal symptoms or diagnosis. As these are derived from your clinical software data, it is recommended that you confirm MBS eligibility through health professional online services. The Search feature allows you to locate specific content quickly. The Remove column lets you selectively exclude individual patients from this report for the next 12 months to assist with patient management by excluding those who have been recalled or have declined an intervention. The Existing Appointment column shows patient appointments scheduled beyond the report dates. You can export the report as an Excel or CSV file by clicking the corresponding tabs, which can then be used for bulk SMS messaging. Additionally, the report can be printed by right-clicking while hovering over it and selecting the Print option. This table lists patients who may be eligible for a 45 to 49-year-old's health assessment and displays a calculated chronic disease risk score and a diabetes risk score for patients. The chronic disease risk score ranges from 0 to 6, with 6 indicating the highest risk, and is calculated on assessment of smoking, alcohol intake, cholesterol level, blood pressure, fasting blood glucose, and BMI. The diabetes risk score is calculated by giving points for the following risk factors: gender, age, fasting blood glucose level, smoking status, prescription of antihypertension medications, and Aboriginal and Torres Strait Islander status. From here, you can look at inviting those eligible for their annual 45 to 49-year-old health assessments. This table lists patients recorded as being Aboriginal or Torres Strait Islander that have not had a health assessment in the previous 9 months. The report looks for Billed Health Assessment MBS items, including MBS item 715 or 228, Aboriginal and Torres Strait Islander Health Assessment. This table lists patients who may be eligible for a 75+ years old health assessment. The table can be sorted by ACG score, allowing you to target the most at-risk patients, age, ATSI status, as well as last assessment date and existing appointment. From here, you can look at inviting those eligible for their annual 75+ years health assessment. The health assessments of patients greater than or equal to 75 years table includes an additional column indicating whether a patient resides in a residential aged care facility. This table also looks for billed MBS items 703, 705 or 707 in addition to the standard health assessments. This table lists women aged 35 to 55 years who have menopausal or perimenopausal symptoms or diagnosis recorded in the past 12 months, where MBS item 695 or 19000 has not been billed in the past 12 months. These items apply only to patients who are experiencing one or more symptoms or undergoing treatment for the symptoms of premature ovarian insufficiency, early menopause, perimenopause, or menopause. So, how can we turn these reports into meaningful quality improvement activities? This report is best used for an activity identifying patients that may be eligible for a health assessment and to invite them to book an appointment with the practice team to complete it. Here we have an adapted version of the National Quality Improvement template that we will be using to discuss one of the activities. For the purpose of this video, we will be discussing page 2 of this document. In this part of the PDSA, we will be going through Step 1, the thinking part. Section 1, the aim. What are we trying to accomplish? An example of a simple SMART goal is over the next 3 months, our practice QI team will increase the number of patients aged over 75 attending for their annual 75 plus health assessment by 20%. Section 2, measure. How will we know that a change is an improvement? In this example, we will be utilising the Primary Sense report to identify the number of patients that may be eligible for a 75 plus health assessment. Given that not everybody appearing on this report may actually be eligible, a referral rate of 20% over 3 months seems reasonable. Lastly, Section 3, change ideas. What changes can we make that will result in improvement? Some potential change ideas could include QI lead to run health assessments report on Primary Sense and send a broadcast SMS to all explaining that they may be eligible for an annual health assessment and inviting them to call the reception to make a health assessment appointment with the practice nurse and their GP. From patients identified on the report, our QI lead will make a note on their file to flag to other staff that they may be eligible for a health assessment, ensuring that this gets picked up and discussed opportunistically when patients attend the practice or phone the practice. Provide education to all staff on health assessments, the benefits, eligibility criteria, practice processes, and a script to discuss with patients who have questions. Provide health assessment promotional material in the waiting room, through the on-hold message, or on the practice website and social media, so that patients can self-identify that they might be eligible. Ensure sustainability of this activity by ensuring that the procedure is documented as a practice procedure. Patients that do not attend for a health assessment are well documented, with adequate recalls and reminders in place. Contact your PHN for support or to learn more about establishing and enhancing quality improvement in your practice.